Good evening. You are with the Urban Debate. I'm Seher Zama. Amidst all the promises that our successive governments have continued to make for our poor, for our children, it is our primary health centers that have been reduced to a tragedy. And it's a tragedy because it has led to deaths. These are deaths by negligence. These are deaths by underutilized funds. In the latest year, in Uttar Pradesh, 79 children dead in Bahraich out of what they call is a mysterious disease, in refusing to admit that there is a resource crunch at the primary health center there. In Delhi, 20 children dead by diphtheria because they seem to have run out of vaccines, and which is already part of our compulsory DPT immunization program. Where are we going wrong?
Bahraich, UP. 79 children died in 54 days. And now, Mirror Now ground check exposes the state of healthcare in India's most populous state.
The first line of defense is the primary healthcare center. I'm standing at one, and what I see around myself is zero availability of doctors. I'm standing outside the door. Clearly, the door is locked. No one available here.
साफ सफाई कम है, ऊपर की ये छत जो है ये मो जो है टाइप 1 टाइप 2 ये ऊपर से छत नीचे चू रही है और जनरेटर की व्यवस्था है, उसमें डीजल की व्यवस्था नहीं है.
Locals allege lack of basic health services like ambulances and medicines.
सबसे पहले तो यहाँ दिक्कत ये है कि एम्बुलेंस सेवा सही नहीं चल रही है.
अंदरूनी जो कोई परेशानियां हैं तो लेडी डॉक्टर है नहीं तो क्या दिखाएं.
सही से दवा नहीं देते, ना कोई इलाज करते.
But it's not just Uttar Pradesh. Even in Maharashtra, 65 people died in 3 months after a swine flu outbreak. Patients and relatives allege essential medicines are in short supply.
Since August now, we have 164 positive cases and we have around 19 deaths.
On Mirror Now, we ask, is India's healthcare system ready for the ambitious Ayushman Bharat Yojana? Or should the government first overhaul the entire system? Let's debate.
Let's debate on this crucial issue. We have Hemant Tiwari, senior journalist, Anila Singh, spokesperson of the BJP, Ravi Duggal, public health expert, Murali Neelkantan, lawyer, Veena Virmani, chairperson of the standing committee of the MCD, and Sujay Kantawala, advocate. Let's make a start with Mr. Ravi Duggal. Mr. Duggal, help us understand. We have so many schemes for public health. State level, central government, previous governments, current government, with the launch of Ayushman as well. Where are we really going wrong in this unnecessary, avoidable list of deaths that we get of our children, of our poor on a daily basis?
Yeah, I mean, our public health system is in shambles. I mean, it's shameful that children are dying due to diphtheria, which has a simple preventable vaccine available. And NFHS 4 tells us that only 62% of children receive full immunization in this country. So I think it's gross failure. It's shameful that children today die of diphtheria in this year and age. And this is largely due to, I see 5 or 6 deficits which are there with our public health system. The first deficit is that we are not doing demand-based planning. Despite having provision like the program implementation plans, which have to be a bottom-up process, or the district planning committees are there, the planning based on the needs and demands of the population, of the citizens, are not being done. Second is the deficit of investment, not putting in enough money in our healthcare budgets, not providing all the human resources, especially at the frontline level, whether in the primary health centers, sub-centers, huge deficits. I mean, at the PHC level, we have a deficit of 30% for doctors. Even in the fewer PHCs that we have, or in community health centers, you have 70 to 80% vacant positions for specialists. So this is the kind of lack of resources that we have. On the other hand, you have fully resourced healthcare systems under the central government health scheme or under ESIS or railways or defense, where all these people who are government employees or politicians are getting health care which costs the state something like 16,000 rupees per capita for CGHS, for example, or for defense it is about 10,000 rupees per capita. But for the aam aadmi, for the janta, for the common citizen, we are spending only 1,500 rupees per capita across the average across the country. Of course, there are variances. A developed state like Maharashtra spends only 950 rupees per capita, whereas a small state like Mizoram is spending 4,000 rupees per capita and has reasonably good primary health care services available. The fourth deficit is the deficit of governance and implementation. I think this is a very major concern because there's complete lack of political will. We don't have benchmarks which we use to provide. Like for example, in education, you have Kendriya Vidyalayas as benchmarks, which are good schools. But in healthcare, despite having the Indian Public Health Standards, which was mandated post the 12th five-year plan under NRHM, you do not see these being implemented. I mean, you're far, far away from simple thing. Like a sub-center must have 2 ANMs, for example, according to IPHS standards. But today we have just 1 ANM if she is appointed in that particular sub-center. And then there's a deficit of accountability and legislative oversight. So accountability systems are very weak. I mean, we have some system for monitoring and accountability in Maharashtra, for example, under the community-based monitoring and planning, which happens in 14 districts or 15 districts of Maharashtra. And it has contributed a lot to improve the footfalls in the public health system because it becomes a demand-based process. But the legislative accountability is missing completely. Nobody questions the executive. When the CAG comes out with a scathing report on the NRHM implementation in 2017, I mean, no legislative oversight follows to demand action from the executive or to put things right. Finally, I mean, all this happens because we are completely market driven. We have moved away our healthcare system from a public good towards a more marketized kind of economy. And that is why Ayushman Bharat today is talking about insurance as a mode of financing in providing hospitalization care to the poor in the country. And I don't think that's going to work. RSBY did not work. Many of the state schemes are not working that well. There are frauds that are happening. So without a proper regulatory mechanism, going in for market kind of based systems is not really going to yield the results that we want. So it is these kind of deficits which actually.
Okay, that's well listed out, Mr. Duggal. Let's get into response here. We have Anila Singh of the BJP. Anila, if you had a chance to listen in to all that our public health expert, Mr. Duggal, has listed out, of course. We're certainly expecting Ayushman Bharat to be doing a great job on ground, but it's no magic wand at the end of the day. It's going to be taking time. Ayushman Bharat also then wanting to focus on wellness centers instead of entirely upgrading the existing PHE. But if we take in the case of Uttar Pradesh alone, we of course are reporting 79 deaths as far as Bahraich is concerned. Our team has done a ground check in other areas, in other interior areas of villages and localities in Uttar Pradesh as well, of other primary health centers. We're going to play up those images on what our team has really found on ground. Villagers have to wade through garbage to go through a center. There's another center there in Tejvapuri, which is lying locked. At 2 p.m. in Mehsi, there are no medicines available after 2 p.m. There are no lady doctors available. Ambulances are just standing. What does one do about the existing health infrastructure, which is causing these deaths to our children? These are avoidable. These are unnecessary deaths.
Absolutely, Seher. To start with, I was not able to hear what my earlier co-panelist had said because voice was audio was not very clear. But what you have asked me right now, definitely it is the point of concern, and that is why day in and day out Narendra Modi ji emphasize on the cleanliness. He keeps on talking about, and he has taken n number of measures for a clean India, Swachh Bharat mission. बार बार वो ये बोलते हैं कि भारत स्वच्छ रहेगा तो स्वस्थ रहेगा, and for that he had been regularly and very carefully. He had been monitoring different schemes as well, so that the cleanliness should become the lifestyle of the people, so that if the area around the house or the community is clean, then many of the diseases, many of the communicable diseases at least, or the vector-borne diseases, that can be avoided. But there is so much. Still we have to do so much in the health sector, and definitely different state governments, like just now you were talking about Uttar Pradesh. Yes, there had been infant mortality in that area, Bahraich area. It is the border district, and many children from Nepal also comes there. But not only Uttar Pradesh, in many parts of our country, many measures are being taken by the state government with the help of the center government, but still more has to be done.
Mr. Murali Neelkantan, as far as holding states accountable for underutilized funds, for existing public health schemes, underutilized funds for the NHM, there have been several reports, even CAG has indicated to an extent to which how underutilized funds are. There's a statewide breakdown that we're going to be playing up on our screens for our viewers to help understand this better. How states need to be held accountable, because being penalized is still an internal process for the center to decide whether or not to penalize a state or not. As someone, as a citizen, as the parent of a child availing schemes and public health center to be a beneficiary of the PHC, how does one further talk about accountability here then?
Unfortunately, it's only political accountability. That's the reality of India. If people at the grassroots, as Ravi mentioned, demand these services, then they're likely to get it. In most cases, money is not the issue. The politicians like to tell us that money is an issue. It is not. So if you take NACO, the National AIDS Control Authority, NACO has surplus funds. If you look at the healthcare budgets of several states, Karnataka is a very good example. They haven't spent their healthcare budget. So they have a surplus carried forward from last year. So money is not the issue. Drugs are not the issue because we produce all the drugs we need. So the question has to be a political question, which is people need to ask their corporators, they have to ask their panchayats, they have to ask their MLAs, why are we not getting our healthcare? The law doesn't really come here to hold state accountable for spending its budget. It's unfortunate, but I can't go to court and say, please direct the government to spend its health budget this year. Unfortunately, a judge will not grant me that order. I don't have the right in that sense to go to court and ask for the budget to be implemented. The difference, however, and there is some hope here, is that on the odd occasion when patients have gone to court and demanded that they be given access to healthcare, a particular procedure, a rare disease, the odd High Court judge has said, yes, you have a right to life and liberty. That includes the right to healthcare. Healthcare is a fundamental right. Therefore, please make an exception and send that patient to AIIMS for surgery. Now, that is an odd event. I don't think you can, from that, gather that every citizen has the right to petition a court and the court will promptly direct a hospital to take that patient in. I mean, the court is not a reception center for every patient to be directed to a particular hospital. So the courts really are an exception here, an aberration. The law doesn't really help in granting you what is your fundamental right. And there's a real challenge with that. We have a fundamental right to health care, but we are waiting for the benevolence of the state to actually implement it to us. And that's the tragedy.
Sujay Kantawala, in your view, a fundamental right to health care, looking at Article 21 on, but still we have our primary health centers, our basic immunization program here, access, right to every child of the country having access to that, still not working on ground.
No, I fully agree with the previous speaker that so many of these budgets which are meant for the public's welfare are underutilized. And therefore, these are serious questions regarding implementation and the mindset of people who are supposed to kind of dole out these schemes. Yes, it's a fact. These are the fundamental rights. It is also a fact that everybody cannot have the wherewithal to approach a high court and a benevolent judge to take up your matter out of turn. Though the judiciary, as I've always said, is the last bastion of hope in this country. So you cannot go to the judiciary at all stages. The issue is that where you have organs of government and one particular organ does not function, then the whole system as a domino effect kind of cascades. You know, it's so appalling to see children dying for no fault of theirs and only because they didn't get medical aid in time, which was available. So the accountability is zero. These people are at the mercy. And which, you know, actually reminds me about a month back when I had gone to a small emirate known as Ajman, which people thought was underdeveloped. But you will be surprised, and your readers will be, and your viewers will be surprised to know that the emirate has a happiness ministry, because they believe that if the people of that emirate are happy, that is a very positive sign of development and prosperity. Are these people that you have shown the images, are they happy? Are we happy? Because the nation, the strength of a nation depends on its healthy people who are happy. If you have a happiness ministry, you look at countries, and I agree about that, we are too many people. Look, you cannot always also say that government did not do A, B, C, D, because we are just too many people. But then that is not the fault of the people. It is not the fault of a child to be born. When a person is born in this country, he acquires his fundamental rights, and it's the duty of the state to provide for it. So I think that this requires a very, very serious introspection, debate and implementation. And I'm glad you are having this debate, because healthcare is something that we see apart from the sanitary part, the hygiene part. Healthcare is something that we are seeing. And mind you, there is one more serious issue that we are facing as a nation, which is of adulteration of medicines, and apart from the food aspect. So unless all these aspects are looked into, we are heading for a catastrophe.
Mr. Hemant Tumari, would you be in agreement of that? Of course, I'd asked Mr. Neela Singh the same on the condition of PHCs, that we've done a ground check as far as Uttar Pradesh is concerned. We're largely talking about hygiene, but you don't need working ambulances, which is largely dependent on hygiene. You don't need medicines in stock, which is dependent on hygiene. There are various other factors to which are not playing out on ground, which is because there is no access to primary health for our children, for our poor.
I think this is the most unfortunate scenario as far as the matter of health care is concerned on the part of उत्तर प्रदेश. बहुत दुर्भाग्यपूर्ण है, और मैं तो ऐश्वर्या पालीवाल की रिपोर्ट्स देख रहा हूँ. मैंने गांव-गांव, कस्बे-कस्बे PHC, CHCs को देखा है. अनिला सिंह बीजेपी की स्पोक्स पर्सन है, उन्होंने एक बात कही कि अभी बहुत कुछ करना है. दुर्भाग्य है कि उत्तर प्रदेश की स्वास्थ्य सेवाओं की दशा I.C.U में नहीं, C.C.U में है. और अभी कितनी अच्छी बात कह रहे थे कि बहुत मौलिक अधिकार होता है किसी भी व्यक्ति का जो इस भारत गणतंत्र का, भारत लोकतंत्र का नागरिक है. दुर्भाग्य है कि जो बजट एलोकेशन होता है जिस पर्पस के लिए, उसका इतना दुरुपयोग होता है. ये बात मैं इसलिए नहीं कर रहा हूँ. किसी भी सरकार की नीयत, किसी सरकार की नीति और उन नीतियों के इम्प्लीमेंटेशन में इतना ज़्यादा गैप है, इतना ज़्यादा करप्शन आप कल्पना नहीं कर सकते हैं. स्वास्थ्य विभाग उत्तर प्रदेश में पिछले कई वर्षों से भ्रष्टाचार के सबसे उच्च पायदान पर बैठे विभागों में गिना जाता है. आप हैरत करेंगी कि जो बच्चों की इलाज के लिए, बच्चों के टीकाकरण के लिए, बीमारियां न फैलें, इससे बचाव के लिए जो स्वास्थ्य शिक्षा के मद में प्रावधान करोड़ों रुपए का था, उसको लूटने के चक्कर में उत्तर प्रदेश की पिछली सरकारों के कई मंत्री और तमाम अफसर जेल में है. दर्जनों CMO जेल में है.
जी.
मिनिस्टर्स बरसों तक जेल में रहे। इस हालात पे क्या किया जाए? रोया जाए? ऐश्वर्या की ही रिपोर्ट आप देख लें आपके चैनल पर। मैं तो बहुत शुक्रिया करूंगा आपके चैनल को, जिसने उत्तर प्रदेश में स्वास्थ्य विभाग की बदहाली का वास्तविक चित्र दिखाया है, द रियल पिक्चर ऑफ ग्राउंड रियलिटी। इनको शर्म आनी चाहिए। मैं किसी एक सरकार को जिम्मेदार नहीं बता रहा हूं, लेकिन पिछले 15-20 वर्षों में बुनियादी जो जरूरतें हैं, आपको पता है 22 करोड़ की आबादी वाला स्टेट है, 18,000 डॉक्टर मिनिमम होने चाहिए, 8,000 डॉक्टर टोटल हैं। पीएससी सीएससी पे आप स्पेशलिस्ट डॉक्टर छोड़ दीजिए, नॉर्मली डॉक्टर गांव में नहीं पहुंचते हैं। 325 विधायकों की बड़ी सरकार है। आपने ध्यान दिया होगा पिछले साल गोरखपुर में क्या हुआ। पिछले साल सैकड़ों बच्चे काल के गाल में गए। सरकार थोड़ी चेती, लेकिन मुझे लगता है कोई एक ही जगह तक उसकी सजगता सीमित कर रह गई। आपने जो रिपोर्ट दिखाई बहराइच की, उसके अलावा मैं बताऊं, रहस्यमय बीमारी जो बुखार है, आपने बहराइच दिखाया जो देवी पाटन मंडल का हिस्सा है। देवी पाटन मंडल में बलरामपुर, श्रावस्ती, बहराइच, और आपने जो आंकड़े दिखाए हैं, सरकार जो आंकड़े बता रही, सरकारी अस्पतालों में मरने के हैं। हमारे प्रदेश में, उत्तर प्रदेश में, खासतौर से पूर्वांचल के जिलों में जितने पेशेंट सरकारी अस्पताल में जाते हैं, उसके 5 गुना पेशेंट्स प्राइवेट नर्सिंग होम्स में जाते हैं। मुख्यमंत्री योगी आदित्यनाथ जिस गोरखपुर से आते हैं, वहां बीआरडी मेडिकल कॉलेज है, डिस्ट्रिक्ट हॉस्पिटल है, लेकिन 100 से अधिक नर्सिंग होम है। कैन यू सिंपली इमेजिन? और अभी बताऊं आपको, बरेली मंडल में, बदायूं, पीलीभीत में रहस्यमय बुखार चला, 2 और जिलों में बढ़ गया, रामपुर और बरेली के आसपास, शाहजहांपुर तक। लखनऊ मंडल के 3 जिलों में यह बीमारी चल रही है। एक प्रश्न करता हूं कि इम्यूनाइजेशन, जो वैक्सीनेशन होना चाहिए, उसकी क्या दशा है? यहां एक्सपर्ट्स बैठे हैं, जीका वायरस अगर है तो उसकी स्पॉट टेस्टिंग होती है। उत्तर प्रदेश सरकार बताएगी, उत्तर प्रदेश सरकार बताएगी कितने बच्चों के यूरिन और ब्लड के सैंपल लिए गए।
Anila, would you like to respond to some of that ground check here that is coming from Mr. Hemant Tiwari as well? While of course, Anila, you would like to say a lot of these are legacy issues. Your government in UP has just come in. But in what you've also announced, the Ayushman Yojana, the Ayushman Bharat mission there, does it take into account accountability? If the government is establishing all of this needs to be done, PHCs, primary health centers need to be upgraded infrastructural wise as well. Other wellness centers need to come up as well. If that's not happening, does this also have an accountability then?
Seher, Hemant Tiwari ji is a very senior journalist of Uttar Pradesh and I respect him a lot. And I'm really happy that he mentioned that only present government can't be blamed for the scenario of health sector scenario. Earlier governments, they did not do properly what they should have done to improve the health sector. Absolutely, without any doubt, when Bharatiya Janata Party came into power in Uttar Pradesh, we inherited a rotten health sector. Definitely, our Minister, Mr. Siddharth Nath Singh, in the leadership of Mukhyamantri Yogi Adityanath ji, is working day in and day out. If we talk about the vaccination, almost 3.5 crores of children have been vaccinated under the Indradhanush scheme. And if we talk about the encephalitis, almost 1 crore of children has been vaccinated for that too as well, and 500 crore of rupees has been allocated to improve district hospitals. And if we talk about the PHCs and CHCs, money has been allocated to improve them as well. So almost 500 medical shops has been provided with the medicines, subsidized medicines. And above all, we know that Pradhan Mantri Narendra Modi ji has inaugurated in Ayushman Bharat, or I can say PMJ scheme for the poor, for the 11 crore poor people living in our country. And undoubtedly our state is one of the most popular state of India. And I am pretty sure that the people living in our state, they are going to get benefited out of it. Yes, it is again the true what Mr. Tiwari said, that we need more doctors, We are starved of doctor facilities in the state. Government is working in that area as well. But yes, even after working day in and day out,
but let's also be realistic. At the end of the day, you don't have the Ayushman Bharat mission as a magic wand, which is going to be miraculously be fixing things in 6 months' time. Let's go across. Ms. Veena Virmani, chairperson of the standing committee of the MCD. It was one of the hospitals under the MCD in Delhi where we had children dying of diphtheria. The death toll today has risen to 20, and so far, on what has been found on ground, it is because of lack of vaccines in stock. So there's further investigation here on that as well. But Ms. Veena, who's to blame here on this? The hospital running out of stock or running out of funds?
Hello. There is a hospital में antibiotics पूरी थी. और ऐसा है कि जो बच्चे वेस्टर्न यूपी से आए थे उनका टीकाकरण नहीं हुआ था और उनका पेरेंट्स जो है वो टीकाकरण करवाते नहीं हैं. उनके कुछ माइंड में उनका एक सेटअप है, कुछ ऐसा भ्रांति है कि शायद टीकाकरण कराने से बच्चों के अंदर पोटेंसी कम हो जाएगी, नपुंसक हो जाएंगे. तो कुछ उनके इस वजह से वो लोग टीकाकरण कराते हैं. उन लोगों ने हमें बताया.
यूपी के अस्पताल की बात करें तो यूपी में लोग कहते हैं कि ये बच्चे नेपाल से आए. अब दिल्ली में बच्चों की बात करें तो आप कह रही हैं ये बच्चे उत्तर प्रदेश से आए. इससे क्या फर्क पड़ता है बच्चे कहाँ से आए हैं? ऑन ग्राउंड तो यही देखा जा रहा है ना कि एक अस्पताल है, फंक्शनिंग है, मगर उसके स्टॉक में मेडिसिन नहीं है. अगर इम्यूनाइजेशन नहीं हुआ है, दूसरे वैक्सीन भी अवेलेबल हैं क्योर करने के लिए.
हमने उनसे पूछा, उन्होंने अपने एड्रेस बताए. हाँ, उन्होंने हमको बताया. जब हमने देखा तो ये सारे बच्चे वहीं से आए हुए थे और हमने उनसे पूछा कि आपने टीकाकरण क्यों नहीं कराया, तो उन्होंने पेरेंट्स ने हमें खुद बताया. और जब वो बच्चे इस हॉस्पिटल में लाए गए तो वो इस हालात में थे कि उनको एंटीबायोटिक्स ने भी इफ़ेक्ट करना बंद कर दिया था, क्योंकि वो पहले 4 दिन 6 दिन 8 दिन किसी हॉस्पिटल में रहे या वो घर पर रहे. वो इस कंडीशन में लाए कि उसके बाद उसके ऊपर कोई दवाई भी इफ़ेक्ट नहीं कर रही थी. ये तो आज हम लोग इतने
Mr. Ravi Duggal, would you like to react to that? The children are brought in, and these are a total of 20, brought in such a condition that no medicines were working on them and they died of diphtheria.
Yeah, and this is just victim blaming. I think this kind of response is pathetic. I mean, you can't get away with this kind of response. एक तरफ you have the BJP representative saying that बहुत कुछ करना है, लेकिन करते कुछ नहीं है. I think that's the ground reality. Things don't get translated into action. बातें तो होती हैं, but so I think we need a very stronger political will to get things going on the ground so that we can improve. They will say that we don't get doctors to work in primary health centers. I mean, you're producing doctors across the country. Why can't you have compulsory public service for 2 to 3 years for doctors? I think that's the solution to it. You have to express your political will to do that. On the bureaucracy, there's no commitment to realizing the goals. You, for your own self, you find out ways of providing healthcare for politicians and bureaucrats, but not for the common citizens. So I think these are very hard questions and we need to answer them. I mean, the electorate will not tolerate this in the coming years.
Okay, Anila Singh, please respond to that. This is a blame game. We don't see accountability being fixed. We don't know what's really happening on the Gorakhpur case. It's gone through multiple flips and flops and controversies. Even in Bahraich, some doctors saying that the children have suffered from a mysterious illness. That in itself should be a concern. No diagnosis. But several parents saying that there have been cases of encephalitis and the Bahraich doctors are not willing to admit it on record because you've just had an encephalitis crisis in Gorakhpur last year.
Seher, if you talk about the deaths of the infants in Bahraich and the surrounding area, definitely they are because of different causes. Different causes, when I say, it means because of the viral, malaria, dengue, because of various reasons. And as I told you that the kids are being admitted from the from the adjoining districts and from the Nepal as well. But it is really disheartening to listen Mr. Duggal. He is health expert and he is saying that though BJP spokesperson is saying that we are doing, but still we have to do much more. So I am going to repeat my words again, Mr. Duggal.
Right.
If I talk about Uttar Pradesh and even if I talk about India. Seher, please let me complete. If I talk about Uttar Pradesh, I'm going to repeat my words in very bold way that yes, we inherited health sector in a rotten state, sir. And if we talk about the center, Prime Minister Narendra Modi ji, he has started so many things in the health sector. Can you deny this fact that he has launched Ayushman Bharat? Can you deny this fact that 12 aims, 12 aims are going to be started and 6 are almost about to start? Can you deny this fact that 24 new medical colleges will be opened in 18 and 19? Can you deny this fact that more admissions in MBBS, more seats will be has been allocated in MBBS and PG courses? Can you deny this fact? The step which he has taken for the
Anila,
mothers.
Okay, you're
Can
listing
you deny
out
this fact that
you're listing out future plans.
No. I am just
Anila, you're listing out
all
future
those
plans.
steps
But
which
if
has
these
been taken by
vector-borne diseases,
our Prime Minister,
one
and Mr.
of what
Duggal
you
is
keep
saying that
repeating,
government
these
is not
children
doing
who
anything
died
and we
came
are
from
sitting
Nepal.
idle.
Even if they
That's
came from
incorrect.
Nepal, their lives still matter. Anila, even if these children came from Nepal who were suffering from encephalitis in Gorakhpur or Bahraich, as you say, their lives still matter. Even if those children came from the border districts and came across from Nepal. Secondly, if you're saying that it is only inhygienic conditions which is causing these deaths, that's unfair because these vector-borne diseases, whether it's encephalitis, malaria, dengue, they're curable. And our PHCs should be well equipped to cure these. Why have children dying of these curable diseases?
Absolutely.
I am going to reply your question as well, Seher. It was necessary for me to tell you that these kids are not only from the Bahraich, they are being admitted in the hospital from the adjoining area. That is why I told you, and I totally agree with you. A child coming from any part of the world, if he or she is admitted in the hospital, the doctors, they should try the level best to cure him. And unfortunately, if some mortality happens, I am pretty sure that none of the doctors they like it. They definitely try the level best. At the same time, again, I am going to emphasize what I said earlier, that yes, the government is trying its level best to improve the PHCs and CHCs. But these infants, when they are admitted, they are already in very bad condition. Most of them are malnourished as well. So several steps are being taken by the government. Again, as you said earlier, that the government doesn't have any magic wand. Time will be taken by the government as well to improve the health sector. It is doing its work,
okay,
but we need we need support from the community
okay
as well.
I'm going to be coming to Mr. Hemant Tiwari for a response to that in just a bit. Let's take in our viewers calling in at this point as well. Mr. Chogle from Mumbai, please go ahead.
Sir, I have heard most of
Anila ji, aapse
yes, sir. How do you read me?
We can hear you. Go ahead, please.
Very good. Good evening to all. I have
let's take in a caller. Mr. Chogle.
Yeah. I am Mr. Chogle. Yes. How do you read? Yes, sir. How do you read? I read you. Yeah, sir. How do you read me? Hello.
We can hear you, Mr. Chogle. Please go ahead. Okay, it seems that the voice is not going through. Let's go to the next caller, Vishwajit Thakur from Kolkata.
Yeah, good evening, ma'am.
Good evening.
Hello. Hello.
Can they not hear themselves?
Mr. Thakur, we can hear you. Please go ahead.
Yeah, good evening, ma'am. Ma'am, this is the really irony. Today, after 70 or 71 after the independence, we are talking about the health centers conditions in our country. I don't know why our health centers or hospitals conditions so poor. Ma'am, tell me one thing. Ask our lawmakers or politicians. क्या आज उनके घर में कोई अगर बीमार होगा वो हॉस्पिटल गवर्नमेंट हॉस्पिटल का यूज करते हैं? मुझे तो नहीं लगता कि कोई भी लॉ मेकर करता है। क्यों? वो जानते हैं, बड़े अच्छे तरीके से जानते हैं कि गवर्नमेंट हॉस्पिटल की स्थिति आज क्या है। दे आर इन सो पुअर कंडीशन कि वहां सिर्फ आज वही लोग जाते हैं जिनके पास कोई और रास्ता नहीं बता होता है। क्यों? मैम, ऐसा एक क्यों नहीं करते हैं कि हमारे लॉ मेकर जो रन करते हैं इतने सारे फैसिलिटीज अपने पावर का, अपने पोजीशन का, गवर्नमेंट हॉस्पिटल के थ्रू क्यों नहीं अपने हेल्थ सेंटर्स को, अपने हेल्थ फैमिली को रन कराते हैं? क्योंकि उन्हें पता है ना कि वहां जाने के बाद कुछ होने वाला नहीं है। वहां ये जस्ट एक पुअर पब्लिक सेंटर बन के रह गया है। वहां एक बार ये लॉ अगर हमारे कंट्री में बन जाए
तो आप कह रहे हैं सरकार की प्रायोरिटी इसमें नहीं है। मेनी थैंक्स फॉर कॉलिंग इन मिस्टर ठाकुर। वेरी क्विकली रिकनेक्टेड टू आवर अर्लियर कॉलर मिस्टर चौगले फ्रॉम मुंबई। प्लीज क्विकली गो अहेड, वी कैन हियर यू।
Yes, yes, sir. Good evening. My this thing is to inform you that. Yeah, good evening to you all. That our reality is that we don't have clean air, we don't have clean water. Yeah. And we have no provision for vaccination of the children. So if these are basic necessities, if they are not given, then where is the health assurance?
Okay. All right. So if the foundations are weak, we got your point, Mr. Chogle. There was a bad audio connect there, but we still got your point. We're glad we were able to put that through. That if the foundations are weak, Hemant Tiwari ji, would you like to respond to that? कि हमारे फाउंडेशंस ही कमजोर हैं। हम आयुष्मान भारत की बात कर रहे हैं, मुबारकबाद दे रहे हैं कि बहुत अच्छा प्लान है एंड वी आर होपिंग दैट इट्स गोइंग टू वर्क वेल, इट्स वेरी वेल थॉट आउट, मगर फाउंडेशंस जो प्राइमरी हेल्थ सेंटर के हैं वही वीक हैं। अगर लोगों को एम्बुलेंस टाइम में नहीं मिलती, अगर किसी को दवा टाइम पे नहीं मिलती, अगर दरवाजे बंद हैं प्राइमरी हेल्थ सेंटर के, तो क्या करे कोई?
बहुत बड़ा, बहुत मौजूद सवाल है। मैं मिरर नाउ के जरिए पूरे देश को इसका जवाब देना चाहता हूं कि जो जनाब सिद्धार्थनाथ सिंह यूपी के हाई प्रोफाइल हेल्थ मिनिस्टर हैं, अभी 1-1.5 महीना पहले उनकी तबीयत खराब थी, तो पीजीआई, संजय गांधी पीजीआई, जो उत्तर प्रदेश का सबसे बड़ा और सबसे महत्वपूर्ण हॉस्पिटल है, वहां एडमिट हुए। चीफ मिनिस्टर में उनको देखने गए, लेकिन माफ कीजिएगा, उत्तर प्रदेश के सबसे महत्वपूर्ण और सबसे बड़े अस्पताल में, जहां सबसे बड़े राष्ट्रीय स्तर के विशेषज्ञ चिकित्सक होते हैं, जिस अस्पताल का बड़ा नाम है, आयुष्मान भारत योजना का कोई पेशेंट वहां नहीं जा सकता। ये मैं रहस्य खोल रहा हूं आपके चैनल पर, क्योंकि संजय गांधी पीजीआई, जहां मंत्री जी इलाज करा के, जहां बड़े वीआईपी इलाज के लिए जाते हैं, वो आयुष्मान भारत जैसी योजना, जिसको मैं खुद अप्रिशिएट करता हूं, मैं अब इस योजना की तारीफ करता हूं, इसके लिए प्रधानमंत्री को बधाई देता हूं, लेकिन आयुष्मान भारत योजना में संजय गांधी पीजीआई उसके पैनल में ही नहीं है। किंग जॉर्ज मेडिकल कॉलेज, जो मेडिकल यूनिवर्सिटी हो गया, छत्रपति साहू जी चिकित्सा विश्वविद्यालय, जो लखनऊ ही नहीं उत्तर प्रदेश का एक और महत्वपूर्ण अस्पताल होता है, वहां भी आयुष्मान भारत वाले लोग नहीं जा सकते हैं। मैं एक बात बताऊं, नीयत और संवेदनशीलता जरूरी है।
So you're talking about access to more sophisticated treatment, but we are narrowing down the focus. We are narrowing down focus tonight here only to the basics, only to the primary health centers which are providing the basics. As far as investigations here go, Mr. Sujay Kantewala, in your view, we were talking about fixing accountability, in penalizing states if they're underutilizing funds which are meant for the PHCs, which are meant for the immunization program, but also fair investigations. We've seen how the investigations, unfortunately, to an extent, have been politicized in the Gorakhpur children death. We're looking at how there can be fair investigations and there can be accountability in these cases. How do we bring this about? In using the law, what is there in the law that we can use to bring in this accountability?
No, absolutely. There has to be accountability and there has to be timelines. See, I'll give you two examples. As you rightly said, as far as the Gorakhpur case is concerned, an appalling tragedy of monstrous proportions took place. And then there was a blame game as usual. There was another very sad case in which a man whose leg was chopped off was brought in one of these trauma centers, and his leg was used as a pillow and his head was put on his leg, which was the chopped off leg. Now these kind of images, now what happened to that?
We played out that case as well.
The person who was responsible had to be immediately prosecuted. That's right. And so there are so many such cases that we see where there is complete lack of apathy, complete lack of accountability. Look, what we need over here is sensitive approach. When you see so many dozens and dozens of people coming to the different kind of public centers and hospitals, are they treated as human beings? The problem is that just because they are poor, the whole difficulty is because they are poor, they are neglected.
But unfortunately, there is no sensitive approach. And perhaps this would come about if there is accountability fixed. If the primary health centers are aware, the state governments are aware that they can be taken to task, perhaps we need another law on that. Who knows? Mr. Sudhir Pandey, our viewer from Mumbai calling in. Please go ahead.
Yeah, I would like to say, actually see this problem, it requires a very holistic approach. And it requires a pragmatic approach. I can see the panelists, they talk in very smartly, good English, and fancy idea. Basically, they want to essentialize the thing. See, what is the real problem? Like what is happening in Gorakhpur, this encephalitis, brain fever. The main cause of the encephalitis is dirty surroundings. There is no medicine for that. If the child is cured also, his life becomes worse than the death. So, encephalitis, the main cause of encephalitis, the brain fever, is the...
It's about cure, it's about treatment and cure being provided in time as well. Not just dirty surroundings, which is what we've been arguing here as well. There are several preventable, curable diseases as well. All entirely doesn't just rest on dirty and hygienic surroundings. Our next caller, Ananta from Bengaluru, please go ahead. Okay, we seem to have lost that line. Ms. Veena Virmani, we were talking about those cases of diphtheria that have taken place in Delhi, where investigations are on, and what has been found so far on ground, that the hospital is being held accountable here for not keeping medicines in stock. What we want to know is, where have the funds disappeared? If the hospital could not buy the medicines and keep them in stock, where have these funds disappeared? This is the MCD hospital run by the MCD that we're talking about.
हॉस्पिटल में मेडिसिन्स पूरी थी, एंटीबायोटिक्स पूरे थे, बट बच्चों का जो कंडीशन था, जिस कंडीशन में बच्चों का एडमिशन किया गया था, एंटीबायोटिक्स वर नॉट वर्किंग ऑन देम. कुछ सीरम में कमी थी, बट सीरम हॉस्पिटल में अवेलेबल चाहे नहीं था, लेकिन मार्केट से प्राइवेटली खरीद के बच्चों को दिया गया था. बट बच्चों का जो कंडीशन था, जिस कंडीशन में बच्चे एडमिट किए गए थे, वो उसको रिस्पॉन्ड नहीं कर पाए.
मैम, सारे 20 बच्चे ऐसी कंडीशन में एडमिट हुए थे, उनमें से कोई नहीं बच पाया. आप किसी को नहीं बचा पाए.
सब बच्चों का ये कंडीशन था. मैं खुद देख कर आई वहां पर.
As one of our experts on our panel, Mr. Ravi Duggal has stated here, hard to believe that a curable, preventable disease of this form here, and you have innocent children dying of this, neither of the 20 in this case here could be saved in time. This is unfortunately victim playing of the authorities. This is a blame game yet again. But we appreciate some of those suggestions here that have come in from our panelists. But let me run those figures again for our viewers on what India is suffering from. We have deaths by dengue, 325. Diphtheria, these are annual figures of 2017. Diphtheria, 5,293. Encephalitis, 2,043. These are astounding figures for a country to be boasting about a public health system, public health centers, which they say on ground are workable. These are curable diseases. Is what we've been saying is that these are curable, these are preventable. No one, no child should die of these diseases. But we are far, far from achieving a golden mean here on this. We've had the National Health Mission as well since 2005. We now have the Ayushman Bharat mission as well, with some more good promises. But we're only requesting that our existing PHCs don't look like abandoned, broken houses. They have enough medicines, well in time provided to the children. They have qualified staff. No one should die because of an unavailability of an ambulance. Let's give that right to primary health, rightfully so, to our children, to our future. As one of our panelists said, a healthy nation is a happy nation, and let's make that happen. Thanks for being with us.